Alrighty, so I am studying for the Neurologic system for Med-Surg 3, and I did not come prepared, so I get to log into everything. Yay! Did not realize there was going to be so many clicking. Okay, 22. Alrighty, so now we're ready. So I've already had the lecture on the material, so what I'm going to do is first I'm going to try to answer the questions at the back of the chapter, which is what I had just pulled up. And then I'm going to answer the questions on the screen, the review questions. And then we're going to jump into the chapter and study like that. Alrighty. Question number 1. Hang on, I'm listening to music and it's a little loud. For this reason, for this purpose anyway. Alrighty, question number 1. While performing an initial assessment, the nurse notes that the patient provides inappropriate responses to verbal communication when showing the patient a key and asking, "What is this?" The response was "Arg, ugh." This clinical finding is referred to as A. Dysphagia, B. Expressive aphasia, 3. Dysarthria, or D. Receptive aphasia. I'm going to go with D, receptive aphasia, because receptive means you're unable to receive written or verbal words. I am wrong. It is expressive. The patient is unable to form the words or say the correct words. Dysphagia means difficulty swallowing. Dysarthria means difficulty speaking, such as slurring words. Receptive aphasia occurs when the patient cannot understand spoken or written words. Alrighty, number 2. When giving instructions to a patient with some dysphagia, further teaching is needed if the patient states, "I must sit upright when I eat." B. I can watch my crime show on TV while I eat. C. I should stay upright after eating for at least 30 minutes. Or D. I should be calm and unhurried when eating. The answer would be B. I can watch my crime show on TV while I eat. The reason why is because you want a quiet, non-stressful environment with limiting distractions, and that would cause a distraction. I am correct. The environment should be as free as possible when eating. Many crime shows are stressful for the watcher. The person should sit upright or in a high Fowler's position to eat. The person should remain upright for at least 30 minutes after eating. The person should be calm and unhurried when eating. Alrighty. Number 3. While assisting the patient with feeding, the nurse describes every step in meal preparation in simple language. This is referred to as A. Parallel talk, B. Self-talk, C. Expansion, or D. Modeling. I'm going to go with A. Parallel talk, because you're speaking what you're doing. That is correct. Describing what one is doing while doing it is self-talk. This is not parallel talk. Expansion. Oh, I was wrong. It's self-talk, not parallel talk. Expansion would be adding more explanation to an already stated communication. Modeling is when you perform an activity for a patient and expect the patient to copy or model the actions. Alrighty, so since I got that wrong, I'm going to look up those words real fast. Alrighty, self-talk means it helps the aphasic person associate activities with a specific word and phrase. The caregiver talks about what he is doing while performing a task, whereas parallel talk describes for the patient what she is doing while she is performing some activity. Those are phrased very similarly. Helps the aphasic person associate activities with specific words and phrases. The caregiver talks about what he is doing while performing a task, like making the bed. Self-talk is done in the presence of the patient so she can make the connection between what is being said and what is being done. What she sees being done. Parallel talk describes for the patient what she is doing while she is performing some activity. Oh, okay, so self-talk is what you're doing, you as the caregiver is doing, and you're talking about it. So if you were making a bed, you would talk out each step that you were doing making the bed. Parallel talk is if the patient is making the bed, you're talking, describing how she's making the bed. That's the difference, is the person doing the action. Okay. Number 4. The nurse is providing discharge instructions to an elderly Iranian man who experienced a stroke. The nurse notices the patient seems indifferent to teaching. The nurse must consider A. talking to the wife or daughter, B. involving the entire family in the care of the patient, C. sending the patient to a long-term care facility, or D. stopping and trying again later. I'm going to go with D, stopping and trying again later, because it's a man and he's probably used to taking care of himself and isn't ready to have teaching done because he is still grieving for his lost independence. Oh, and again I'm wrong. Okay. Speaking to the wife or daughter would be the first step in determining whom instructions should be given. It would be unusual to include children in any teaching concerning an adult male unless the family has agreed to include them. There is no data indicating that the patient needs to be sent to a long-term care facility. Stopping and trying again is okay, but time may run out before discharge. It is better to seek a solution to get the family and patient instruction in post-discharge care for the family. I guess because the patient is getting discharged, you can't really keep them around to continue teaching. You gotta make sure that they understand. That would be what I would assume anyway. Alrighty, number 5. With an open hand, the nurse presses over the flaccid bladder of a patient. When questioned regarding the nursing action, an appropriate response would be A. The technique increases the muscle tone of the bladder. B. The maneuver facilitates removal of urinary sediments. C. The technique assists with complete bladder emptying. Or D. The technique reduces the incidence of bladder irritation. It's going to be C. The technique assists with complete bladder emptying. Because, did it say Credé mover? No, but it's flaccid. So the flaccid bladder is not able to empty by itself, so it needs assistance. Credé. Credé's maneuver assists in emptying the bladder completely. Using this maneuver does not increase bladder tone. The maneuver is not used to facilitate elimination of urinary sediments, although some sediment may be expelled with the urine. Credé maneuver does not reduce bladder irritation. Alrighty. 6. To assess blank, the nurse shines a light on the right eye and watches the left pupil. A. Accommodation. B. Consensual reflex. C. Direct reflex. Or D. Blink reflex. It's going to be 2. Consensual reflex, because what one does, the other does. Yep. Shining in a light in one eye while watching the pupil of the other is done to assess for a consensual reflex where the pupil constricts. The test for accommodation is done by having the patient look at a far object and then at your finger about 6 inches from the eyes. The pupil should constrict. Direct reflex is when a light is shown into the eye and the pupil constricts. The blink reflex is when something approaches the eye and the patient blinks by the lids closing automatically. Alrighty, number 7. The nurse uses the Glasgow Coma Scale to evaluate the neurologic response of a patient. The patient opens eyes to pain, makes incomprehensive verbal sounds, and extends extremities with pain. The score would suggest A. Locked-in syndrome, B. brain death, C. coma, or D. lethargy. I'm going to go with C. coma. And I don't have a reason why I'm choosing that. Okay. A Glasgow Coma Scale score of 6 indicates coma. The score is 6. The score does not indicate locked-in syndrome, where the patient is awake but cannot move or speak. A score of 3 might indicate brain death, but not a score of 6. Lethargy would most likely produce a score of 14, not 6. Okay. Number 8. The nurse demonstrates understanding of the physiologic changes in the nervous system associated with aging by A. Providing extra time for the patient to process and answer questions. B. Reminding the patient how to perform activities of daily living. C. Finishing the patient's sentences when responding to questions. Or D. Communicating slowly and loudly with low-pitched tones. It's going to be A. Providing extra time for patient to process and answer questions. The reason why is because B They don't need reminding. They don't need you to finish their sentences. Just give them time to finish. And D is just bad practice all the way around. Alrighty. It takes an elderly person to... I was right. 1A. It takes an elderly person longer to process information and formulate a response or answer. An intact elderly person does not need to be reminded of how to do activities of daily living. Reminding of how to do each task may be perceived as demeaning. It is rude to finish someone's sentences when the person is capable of responding. The intact elderly person just needs time to respond. Speaking in a loud or low-pitched voice is not warranted. There is no indication that a person is deaf or hard of hearing. Alrighty, number 9. I'll leave it up. The nurse scrapes an object along the sole of the patient's foot and notes that the great toe bends upward and the smaller toes fan outward. The clinical finding is suggestive of A. Sensory abnormality of the cortex, B. Motor abnormality of the cortex, C. Cerebral tissue destruction, or D. A normal finding. It's not a normal finding, because if it was normal, it would curl inward, not outward. So, it would be a motor abnormality. Yeah, it is. A present Babinski sign is indicative of an abnormality in the motor control pathways leading from the cerebral cortex. A present Babinski sign is not a sign of cortex sensory abnormality. The present Babinski sign does not indicate cerebral dysfunction and is not a normal finding. Alrighty, D. Which nursing interventions would be appropriate when providing care for a patient with a right hemiplegia form of stroke? Right hemiplegia from a stroke. Select all that apply. A. Reminding the patient to pay attention to the left side. B. Protecting the right extremity during transfers. C. Supporting ineffective arm with pillows. D. Using a sling on the effective arm to promote better balance. And E. Initiating range of motion exercises. B, D, and E is what I'm going with. And I was right. The effective extremities must be protected during transfers. A sling on the effective arm does not help promote balance. Oh, does help promote balance. I'm like, not. Where did not come from? Range of motion exercises are a standard part of nursing care for the patient with hemiplegia. Right hemiplegia means that the right extremities are weak, not the left ones. The effective arm should be supported with pillows when the patient is in bed or sitting in a chair to prevent shoulder injury. The other arm is not supported in this manner. And that answers the question at the back of the book. And hang on one second, I need to get a cup of water to drink. So there's going to be noise and quiet for a moment.
The real point is you can deafen human attacks. That's really the only thing we can do.
Alrighty. I am back. Alrighty, time for the review questions for the NCLEX exam for Chapter 22. The nurse is performing a neuro check on a patient who has demonstrated a decreased LOC. What is the best way to assess the patient's neuromuscular status? Check the patient's response to the stimulus of pinching, determine whether the patient's able to move his legs and arms, measure the patient's vital signs, test the reaction of the patient's pupils to light. A decreased level of consciousness. No. I'm going to go with check the response to stimulus of pinching. It's not the vital signs because that's not going to do the neuromuscular status. Neither really is the check the patient's pupils. If they have a decreased LOC, they may not be able to respond to if they can move their legs and arms. Though you don't necessarily want to pinch them either. The patient who is scheduled for an EEG asked the nurse about the test. Which response by the nurse is most accurate? It's an electroencephalogram, which means that electricity will be used to measure the activity of your brain cells. There is no electricity involved. It just looks that way because they attach a lot of electric wires to your scalp. It's a recording of electrical output from your brain. The electroencephalogram machine receives the output in the same way the radio receives sound waves. There's nothing to worry about so long as you do exactly as you're told. The encephalogram technician has had a lot of experience in handling the electric wires and the machines. Yeah, that's just going to make them feel worse. This is false. I'm going to go with this because it's the most accurate. The student nurse observes the nurse as she measures the patient's intracranial pressure. The student nurse correctly defines ICP with which statement? ICP is pressure resulting from changes in fluids. ICP is controlled by the central nervous system. ICP is the pressure exerted within the cranial cavity by its contents. ICP is a measurement of blood pressure within the brain. The pressure exerted within the cranial cavity by its contents. The nurse is assessing the patient's patellar reflex. The patient asks what the purpose of this exam is. Which response by the nurse is correct? I am checking the conscious nerve response in your leg. Checking this reflex assesses involuntary muscle contractions. The patellar reflex demonstrates large voluntary muscle coordination. This assessment determines your hand-eye coordination. Yeah, it's definitely not that. That's worded weird to me. I'm going to go with this, because this is what I feel like is correct. But you're checking the nerve. I'm going to change it to the nerve because it's technically what you're tapping. The nurse is assessing a patient who has a brain tumor. What assessment finding is most indicative of increased ICP in this patient? Increasing blood pressure, decreasing level of consciousness, agitation and hostility, elevated temperature. Agitation and hostility. The nurse is measuring the pressure of the cerebral spinal fluid. Which statement accurately describes CSF? It cushions and protects the brain. We're taught 70 to 125, but I'm not going to count that as right. It is formed continuously within the ventricles of the brain as a filtrate from the blood. True. Circulates within the arachnoid space. True. It is reabsorbed by the arachnoid villi at the same rate at which it is formed. I don't know, so I'm not going to say that's true or false. Which findings should be considered abnormal CSF results from a lumbar puncture? Protein of 40 milligrams, glucose of 20 milligrams, clear colorless appearance, or white blood cells at 100 millimeters cubed. White blood cells. The nurse is giving pre-test instructions to the patient who is scheduled to have an electroencephalogram. What should the patient be instructed to avoid prior to the exam? Coffee and cola drinks because it's caffeine. Sleeping pills because they can't have it. Alcohol because of its depressive effect. And that should be it. The nurse is caring for a patient following a cerebral angiograph. What nursing interventions are necessary following this procedure? Select all that apply. Monitoring neurologic status, assessing the catheter puncture site for bleeding, obtaining regular electrocardiograms, checking for the return of the gag reflex, assessment of pulses distance to the puncture site. I'm going to leave that one alone. When assisting with a lumbar puncture, the LPN helps the patient maintain which position? Knee chest with lower spine supported by pillows, side lying with knees drawn up and spinal column curved, knees slightly bent with spinal column straight, semi-Fowler's position with the head bent downward onto the chest. And the only time you would do that is if you're given a I forgot the term. Epidural for labor. I'm going to go with that for the simple reason that the knees are to the chest. You want the spinal column curved. The reason why I wanted to choose pillows is because I feel like I've remembered this and it was pillows, even though it made no sense to me. When increased ICP is suspected, the nurse performs a complete neurologic assessment. What does the pupillary response indicate? High pressure can cause blurred vision. Pupil changes can be caused by pressure on the ocular nerve. Hemorrhage can cause visual impairment. And pupil dilation is the first sign of ICP. Pupil changes can be caused by pressure on the ocular nerve. A patient who is to have a computerized tomography or CT scan of the brain voices concern about the procedure. The LPN can best allay the patient's fears by making which statement? The CT scan only uses a small amount of radioactive material injected into your brain. That is beyond false. The procedure is safe and painless. You'll hear a clicking noise as the CT machine rotates. The CT scanning is a new procedure, and since it involves the brain, I think the doctor can answer your questions better than I can. No, that's false. You'll probably be given something to make you drowsy and deaden the pain during the CT scan. That's false. That is true. What nerve is most likely to recover after injury? Technically, no nerve recovers after injury. The student nurse is performing a neurologic assessment on a patient. When checking changes in the size of the pupils, which action by the student is most appropriate? Have the patient in a brightly lit room and cover one eye while testing the other. Darken the room and then shine a light onto each eye from the side. Shine the light in both eyes and compare the way in which the pupils constrict. Use a drug to dilate the pupils and after a few minutes test the reaction to light. No. You would do the opposite, so darken the room. And you would come from the side. During the physical assessment, the nurse notes the patient has a decreased level of consciousness. What is most likely the direct cause of the decreased LOC? Brain tissue affected by anoxia, pulmonary obstruction resulting from chronic obstructive pulmonary disease, hypertension, or age-related perfusion deficiency. I'm going to go with pulmonary obstruction because if you're not getting enough air, it'll cause A and D to happen. When rating a patient using the Glasgow Coma Scale, what would be appropriate for the LPN to ask the patient to do? Describe the view from his window, touch his nose with his left index finger, roll his eyes in a circle, take a deep breath and exhale. Touch his nose. Touch the nose. The LPN discusses ways to prevent a stroke with a patient. What measures should the nurse include in her teaching? Prevent. Proper treatment for hypertension. Keeping your cholesterol under control. That's not going to help. Encouraging the use of seatbelts, that's just going to keep you alive. Adequate treatment of atherosclerosis. That's true. Avoiding the use of recreational drugs. That's very true. And I did pretty bad. 9 out of 17. Alrighty. The nurse is performing a neurocheck on a patient who has demonstrated a decreased LOC. What is the best way to assess the patient's neuromuscular status? I answered with check the patient's response to the stimulus of pinching, which I remember saying that I was unsure about. It is actually determine whether the patient is able to move his legs and arms. When performing a neurologic check on a patient with decreased LOC, the nurse should determine if the patient can follow simple commands by asking him to move his extremities. The nurse is assessing the patient's patellar reflex. The patient asks the purpose of the exam. Which response the nurse is correct? I answered, I am checking the conscious nerve response to your leg, which I said that I chose that one second guessing because of the word nerve, when in fact it was my first response. Checking this reflex assesses involuntary muscle contractions. And a reflex is an action or movement that is built into the nervous system and does not need the intervention of conscious thought to take place. The nurse is assessing a patient who has a brain tumor. When assessing finding is most indicative, I can't pronounce that, of increased ICP in this patient. I answered with agitation and hostility, when in fact it was decreasing LOC. LOC is the earliest indicating of increased ICP, and it's elevated by assessing the patient for changes in responsiveness. Widening pulse pressure, not just blood pressure, is a better sign of increasing ICP. Assessing the patient for changes in cooperativeness or move is also significant, but LOC is more sensitive and occurs earlier. Although indicative of other CNS disorders, usually of the hypothalamus or infectious processes, increasing temperature is usually not helpful when evaluating signs and symptoms of increasing ICP. Alrighty, the nurse is measuring the pressure of the CSF. What statement accurately describes the CSF? Alrighty, so the one that I said that I wasn't sure of also ended up being true about the arachnoid villi. And C, 70 to 125. So that would have been wrong. Alrighty, the nurse is caring for a patient following a cerebral angiograph. What nursing inventions are following this procedure? You would check neurologic status, but you would not check for a return of a gag reflex. You would be assessing for dysphagia and respiratory distress. So, alrighty. When assisting with the lumbar puncture, the LPN helps the patient maintain which position? See, told you, pillows. That was the correct answer. To widen the intermural space of the lumbar puncture, the patient should be maintained in position with back bowed, head flexed on chest, and knees drawn up to the abdomen. Which nerve is most likely to recover after injury? It says peripheral. And the reason why is because of this outer membrane called a neural lemma. Alrighty, during the physical assessment, the nurse notes the patient has a decreased LOC. What is the most likely direct cause of this decreased LOC? Brain tissue affected by anoxia. Prolonged anoxia leads to brain death. Decreased LOC is an acute condition. The other options are chronic disorders. Okay, fair enough. Hang on a second. Oops. Let's not do that. That would be confusing. Alrighty. Be really funny if y'all could hear my stomach just going glue, glue, glue. Am I even done with this? It looks that way, cool. Alrighty, sorry about the silence. Okay, so we're going to start with the beginning of the chapter. Normally what I like to do is and I just lost my train of thought. Try to answer the objectives and then go from there. Okay, I'm distracted beyond belief, so this is going to be part 1, and I'm going to do part 2, which is going to be this overview that you see right here. And it's going to go along with the chapter, so, excuse me. I shall return.